I've seen many misleading ads about spine surgeries and golfers returning back to golf, professional golfers or amateur golfers, and I treat golfers every week, and they're not factual. These are the facts. Uh, there is no spine surgery that has greater ability to allow a golfer to return back to golf than the Discseel procedure. There's no physician who can discredit that fact. And here's why. It's based on science. It's based on the laws of nature. Uh, when a person undergoes a spine surgery of any type, if it's an artificial disc or a fusion, that's going to immobilize a segment of the spine, and that'll cause adjacent forces to be displaced elsewhere. That's a fact of life. We can't change that. That's what a fusion does. Even if it's a minimally invasive fusion, minimally invasive fusions kind of are a guise to attract people because they believe that there's less damage. No, it's the same damage on the spine. So that fusion is going to immobilize that segment of the spine, and that means that those force vectors increase forces above and below. They have to. Ask your surgeon. There's no doubt about that. And then with respect to discectomy, when the surgeon removes the piece of the wall, whether it's a microdiscectomy, it's using a laser or a scalpel, it does the same thing. It damages the disc. It removes the wall of the disc. That disc is made with its 17 layers purposely. And when a surgeon removes those layers, it can only weaken the disc. Compare that to the Discseel procedure. With the Discseel procedure, number one, it does not cause the damage that a fusion does by displacing forces above and below, but instead it allows that treated disc to return to its natural state. When a discectomy weakens a disc, golf is only going to accelerate the degeneration of that disc. The Discseel procedure won't do that. It's the opposite. The Discseel procedure has been demonstrated scientifically to strengthen a disc. It regrows disc tissue. It's been demonstrated in placebo-controlled investigations by University of California and elsewhere. No other procedure does that in the spine. The Discseel procedure strengthens the disc instead of weakening it. It stops it from leaking. It stops the inflammation that causes the symptoms. So if a golfer hopes to get back to golf, long term, not just for a year, but for the long term, their very best option is a procedure that'll regrow a disc to its normal strength and consistency and not cause aberrant forces above or below that segment. And the Discseel procedure is the only procedure that exists. And it's probably for that reason that every week we treat many golfers, whether they're professional or amateur golfers, and they're all enjoying golf long into the future when compared to others who fall to having the surgical spine procedures.